Well, South African Health Products Regulatory Authority says that there are 3 more vaccines that have been applied for to be used in the country. It says that Sinopharm vaccines, Sputnik V and Sinovac vaccines are in the process of review before they can be approved to be used. SAHPRA also says that they also need to monitor the efficacy of these vaccines, especially against the new variants that keep emerging in the country. Currently, South Africa is using Johnson & Johnson, Pfizer and Astrezeca vaccines. We're now joined by Dr Rajesh Patel, who is Head of Benefits and Risk at the Board of Healthcare Funders, to give us some perspective from medical schemes on the vaccination program and what this means for the country and the role really of medical schemes in supporting efforts to reach the 67% target for herd immunity. A very good afternoon to you, Dr. Patel. Thank you so very much for availing yourself to SABC News this afternoon.
Good afternoon to you and to the viewers out there.
Doc, let's talk in general about, what role medical schemes should or are playing essentially at this time as we're dealing with a pandemic. We've not experienced, obviously, a pandemic before, and so I imagine that medical schemes have also kind of had to, in the process, figure out that role when coming particularly to the issue of vaccines, but in general of the pandemic at large.
Yeah, that's very true. I think, if we reflect back last year, our Board of Healthcare Funders was actually proactive in this regard, and we felt that this was a national disaster. It's a pandemic that's affecting the entire planet. And we felt that it was absolutely critical that medical schemes step up and fund whatever is needed. At the end of the day, this is something that if we put the right mechanisms and interventions in place, we can actually avoid as much as possible. So right from the beginning, we supported the benefit being classified as a prescribed minimum benefit. We fully supported having the funding for the testing to be done initially. And obviously right now, fully support the vaccination program and the funding for vaccinations. As they approved by SAHPRA.
Yeah. SAHPRA has said that other vaccines like Sinopharm, Sputnik V, which has been widely spoken about, Sinovac, are in the process of review before they can be approved for use. What's the reaction or perhaps maybe the stance of medical schemes to the intro of many other vaccines? What's your view? And on the back of that, what's your view on South Africa's current vaccination program?
So quite simply, SAHPRA is the regulated body that has to approve these vaccinations. Once approved, even if it's on an emergency basis, that means it becomes available for use in South Africa. And when administered to our medical scheme members or their beneficiaries, it becomes an obligation for medical schemes to fund.
Yeah.
The Sputnik and the Sinovac vaccine that you're talking about, if those are not registered, the bottom line is none of the service providers will be able to purchase them, and therefore it will not necessarily be available for anyone to have it administered. So literally we have to wait for SAHPRA to review the evidence and make a call on whether it's safe and sufficiently effective for it to be used in the country. And we fully support them and we fully back them, full hog kind of thing on what they're doing and the way they go about doing their work.
Yeah, and I'm sure with that support, though, it wouldn't be unfair to level any sort of criticism, whether it is, especially if it is constructive. I mean, the fact of the matter is that South Africa's COVID vaccine rollout can be sped up, and in light of logistical and administrative challenges that we've been told about, surely there are other ways and means in which that vaccination can and should be sped up. And I wonder what your contribution to that issue is in terms of how that could be made possible.
Certainly. Unfortunately, we work on the funding side, so we're not directly involved in service provision.
Yeah.
But we work with the Business for South Africa. This is the alignment of business supporting government in these initiatives. And obviously, we've been trying to look after the funding component. While we've been working with them, obviously, we've been getting feedback about the dosages, the availability, what's coming, what's not coming, the problems that's been experienced. And we've been aware that the supply of vaccine up till end of this month was going to be very limited, and you can only do so much. But from the 1st of July onwards, there'll be a lot more vaccines becoming available. There's also going to be a lot more vaccination sites becoming available. So I think the entire program will kick into a new gear right from 1st of July onwards. And as you've noticed, the over 50s can now start registering from 1st of July. So I'm sure as soon as they start trickling into the provider clinics kind of thing for vaccinations, you'll really see a massive pickup. It's just been unfortunate that we haven't seen many over 60s, even those on medical schemes, registering in sufficient numbers.
Yeah.
And I think this is where BHF has tried to communicate with its members, medical scheme members as well, and ask them to actually communicate directly with their members, encouraging them to register. There are a couple of ways to control this disease. One is the vaccination, and the other is the social distancing, the masks, etc., that we need to do to try to minimize the effect of this pandemic that's going around everywhere around the world.
Yeah. And just in closing, you talk about the fact that there aren't people registering in sufficient numbers when it comes to the vaccination process. It's as though you anticipated what I was to ask you next. In terms of medical schemes and the way in which they communicate, I mean, for example, my communication comes via email. There are many other people who, are not able to have that sort of access that perhaps that I would be able to have access to. And I wonder if that's not also contributing to the issue of less registrations at this time. I mean, some people have their parents, for example, on their medical schemes, and maybe the messages aren't necessarily trickled down effectively as they should be. And I wonder if there's ways in which medical schemes can then find ways to better communicate, because not all of us are able to communicate in the same way.
Absolutely spot on. This is the discussion we've been having internally during this week, and we've been trying to work out all the different mechanisms in which medical schemes can communicate to their membership. And that's what we're going to try to communicate to the schemes, to use literally every avenue available to them to communicate, whether it's the social media, SMSs, emails, etc., including call centers if necessary, those who have got nurse networks in place, etc., try to use those networks to get directly to those individual members, whether it's calling them or encouraging them in any way possible. I think it's absolutely important, and I agree with you, not everyone has those accesses that we're talking about, the cell phones, the emails, etc., and we need to try to do everything possible to get to them. Yeah. Even through the employer groups that affiliate themselves with medical schemes, we should be communicating to members of medical schemes via that employer groups as well.
Yeah.
And through the consumer representative bodies, etc., trade unions, etc. So that's the kind of thing that we've been looking at internally, of trying to put an entire plan together that could assist medical schemes to consider all the different options to communicate to the public out there, and specifically the medical scheme members.
Yeah. Dr. Patel, it's been a pleasure speaking to you. Thank you for giving us your time.
Thank you very much. Thanks for having me on this afternoon.